Hi everyone, welcome. Today we are very excited because we have Dr. Taylor with us. She is a naturopathic doctor with special focus on mental health. So I was very excited to find out about her. We had some conversation outside this session, and I'm like, we need to talk because there's so much that general public doesn't know. So Dr. Taylor, welcome. Thank you so much for joining us. Why don't you introduce yourself and how did you get into like naturopathy and mental health? Like, how did that all come together?
Yeah, thank you so much for having me today. I'm really looking forward to speaking about a passion that's definitely very dear to my heart. So that is usually how I start is my explanation of how I got to where I am today. Because it wasn't without my own personal struggles with mental health, I don't think I would be where I am today. And so without going into too many details for time's sake, it was through my own mental health struggles that guided me towards your typical conventional care medicine. And um, unfortunately, I didn't have the greatest experience in terms of what it could offer me and provide me for my own mental health support. And so I turned towards complementary alternative medicine, therapy, and things like that. Actually, it was a therapist that referred me to a naturopathic doctor. And at the time, I asked, what the heck is a naturopathic doctor? And so that really guided my care towards that side of things. And what I found to be the most significant was the amount of time that we got to spend together going over my story, going over all the different options in terms of what encompasses mental health in its entirety. And so that's not to say there's anything necessarily wrong with doing anything within the conventional standard care method. I'm on a mission and I have a very large passion to providing outside information in terms of how many different things can influence mental health in addition to standard of care medicine, which I will typically always follow.
So can naturopathic medicine help with some of our standard, things that we see in our field of psychotherapy, like anxiety, depression, post-traumatic stress, or even eating disorders? Like what has been your experience? Like what do you see, and how does naturopathic medicine support these conditions?
Yeah, so I feel like that could be a whole hour conversation on how those things influence each other. But one big thing that I will say is that naturopathic doctors in British Columbia have a very, very large scope, and including within that is pharmaceutical medicine. So we do have to write an additional course and exam, and so that just gives us, more options within our toolbox. And one thing I will say is that I'm very open. I do prescribe medications for a variety of different reasons or conditions. But I think the biggest piece in where naturopathic doctors can fit into mental health is a few reasons. One is the amount of time we get to spend together. And then a few other reasons is that because of the time we get to spend, and because of our large scope, we can look into potential root causes, contributing factors. We have an hour with our initial patients, and so we can run blood work, and that's something I find that's often missed, and maybe not as thorough as maybe we need to. So looking at things like your iron, your thyroid gland, vitamin D, B12, those are kind of just baseline, standard of care testing that often isn't done. So that can be an additional benefit. And then in terms of all the other things that we can tackle onto that, in addition, I definitely refer quite often, if not always, to therapy, psychotherapy, whether that's an RCC or psychologist. And so I think that is actually very complementary and works really well with naturopathic care because we're looking at the whole picture. And as you know, our mental emotional health and the way we manage thoughts and emotions are a significant portion of what's happening for a lot of people. And so I feel like that combination works really, really well together in terms of like addressing all the aspects that can influence mental health.
What do you see in your field of work, Dr. Taylor, in terms of what are some contributing factors, like lifestyle factors that influence mental health?
Yeah, so one big thing is one thing I work on a lot is nutrition. So that's a big piece of it. So it's a difficult topic to study, nutrition in its entirety, let alone when we're talking about mental health. So there are some very high level evidence based nutrition papers on like a Mediterranean style pattern of eating. One specific one is called the SMILES trial, and they looked at moderate to severe depression, and they followed individuals for about 12 weeks, and they found that about 30% of those individuals were in remission from that depression. So that's significant. Obviously, we need a significant amount of studies to really hone in on that, but I my approach to nutrition tends to be that I find that the wellness world, we kind of overemphasize nutrition sometimes, and it can become very restrictive and can lead to worsening of mental health, I find. And then as a conventional care system, we often underemphasize it. So I do try to stick somewhere in the middle of obviously what we fuel our body makes a significant difference. Maybe just not as significant as some people do say. So eating, basic things like fruits, vegetables, whole grains, lots of protein, making sure we're eating enough is a huge thing that I find, especially with anxiety and panic attacks, that window of which we get that low dip in blood sugar or we get hangry, for example. Those are all things that um, I focus on. And then other pieces of that are exercise, movement, stress management, whether that's like deep belly breathing, diaphragmatic breathing. I do actually have additional training in mindfulness meditation, and so I bring that into a lot of what I do, which I feel like can be such a big component to what individuals are experiencing. And again, big piece is referring for the mental emotional aspect and the significant trauma or adverse childhood events that often are a part of mental health, that I feel like people don't even realize how some of the things that they've happened to them have kind of shaped and viewed and maybe changed the lens of which they see the world. And so sometimes just spending that long time with them can be like, oh, have you ever noticed that those might be related, and piecing that together for people can be really empowering. Yeah, I feel like I might have gone on a little bit of a tangent there, but those are definitely
Yes,
big
yes.
things. Yeah.
I was also very curious. Do you think like naturopathic medicine can help with things like ADHD or autism or some other like OCD, like some of these other concerns?
Yeah, I think like anything, especially mental health, I don't know that one person can help all of the aspects that influence mental health. And so I do think it really takes an integrative approach. So I will say that I do think that um that there's avenues and there's abilities within naturopathic medicine that can help most things, including ADHD, including autism, including OCD, but that needs to be tackled on with an integrative approach, especially things like OCD and maybe some more complex chronic mental health conditions that really, the standard of care is a lot of intense therapy and psychotherapy. But I've found quite a lot of success with ADHD. I I don't have a lot of experience or clinical expertise within the OCD or autism world, but there are other naturopathic doctors, and I always suggest like finding those people with a little bit more clinical focus can be really profound. But I definitely think that just based on the time and all of the aspects that we focus on in terms of an integrative multifactorial point of view, there's always things that we can help with standard of care or complementary medicine.
Yeah, no, that all makes so much sense. And sometimes when we have these conversations regarding medication with some of the folks that we support as clinical counselors, sometimes
Mm,
they are hesitant because of the dependency on the medication. So
right.
wonder like how is naturopathic medicine different in that regard? Like how do we reduce that dependency, but like still give the support, right? Or sometimes
Yeah.
it is a lifelong thing. So how do you find that balance or?
Yeah, I find that can always be a really tricky area just because the way in which some individuals were diagnosed, but also prescribed, it is sometimes the way we prescribe it is often like this may be a long-term forever thing. You may need to be on this forever. And so the approach in which we prescribe medications can be so impactful. And so what I will say is that I think that might be somewhere where the conversation, like, for example, if an individual has been prescribed a medication from their family doctor and it's been a long time, having that conversation and knowing that we doing all the work in combined with therapy and medication. So if we're working on all those aspects, then maybe a year, 2, 3 years later, to get you through the hunch of it, we can start working on maybe decreasing the dose or talking about if it's a good time in your life to start weaning off that medication, if that's appropriate. So I feel like for a lot of the answers to those questions, it really depends on the individual and what's going on in their life right now. Because I feel like, we have that some people that want to no don't want to be on medications, but it's really making that big difference. And then we have individuals that maybe feel like they need to be on it forever, and maybe that's not the case. So just having that conversation and seeing within that window of time if that's a good time in their life to talk about those changes within medications, or maybe we don't need it anymore. Maybe because of the medication and the therapy and exercise and nutrition and all the things that we've added on, now you feel more self-sufficient. And so that's kind of how I approach those situations.
No, that makes sense, right? Like it's assessing and then having conversations at the right time. And like you said,
Mm-hmm.
full hour makes a difference versus like in a regular setting, like, they only have 5 minutes. Our health
Yeah,
system is so thinned out or spread, right?
I
Spread.
know.
So
Yeah.
yeah, it's
Yeah.
nice to have these complementary options. So what are some of your favorite remedies or tools? Like I know mindful meditation is a big piece, but what other tools do you often use with the clients that you support?
Yeah, so a big thing would be to make sure there's no nutrition deficiencies happening. So making sure like thyroid's working well, iron is up to an optimal range. That can be an area where it may be not like iron deficiency anemia, but you could be iron deficient and still be symptomatic. B12, vitamin D, so those are common ones where I'll go to, depending on the individual. Things like omega-3s and fish oils can be really helpful for depression. Um, Even in conjunction with medication, it has been shown to improve the efficacy of certain medications, and that all depends on how much fish intake you're getting, how many omega-3s you're getting from your diet. So that's all part of it. Um, in terms of other treatment modalities, so we use a lot of botanical herbs in our I guess toolbox within naturopathic medicine. So a few common ones are things like St. John's wort, um, that is somewhat used similarly to those common SSRIs, SNRIs for depression. Things like saffron have been quite prominent in the research. With all of these things, we just need more research, so it's always hard to, compare them. But there are studies comparing our standard of care medication to saffron, which having similar effects, which is amazing. Just providing another option for individuals can be quite profound. Like if you're managing it well and there's no problem, that's great. But for some individuals, significant portion of the population do experience quite a lot of side effects. So that can be an addition. That's been shown to help for things like depression, anxiety, even ADHD. There's some smaller studies around that. And then there's things like lavender that's been shown for anxiety to be quite helpful. Things like theanine and GABA are more like nutrient amino acid based things that we can use. So there's quite a lot of things within like nutrient supplements and botanicals. Things like SAMe can be really helpful as well. So all of these things to say that very much depends on the individual, what medications there are, making sure there's no interactions within anything that they're taking, and that it's a good fit. And then just on top of like how I address certain mental health conditions as well that I didn't mention earlier, things like hormone-based conditions can be quite profound within naturopathic medicine. So we look at like PMS, PMDD is definitely something that's not addressed enough, I find, in the conventional care, and the window of vulnerability with postpartum, with perimenopause and menopause. All areas that we can help with that mental emotional aspect and the physiological state that sometimes contributes or worsens even pre-existing conditions. So those are kind of big areas that I focus on, but we have more things like intravenous or intramuscular injections, and also acupuncture, something that I use just for individuals to come in, have that half an hour to an hour, just stress relief, calming, a time for themselves for a lot of busy moms, just to get out of the house and, take some time for self-care. But our scope is quite large, so it very much depends on the individual's need and what they are looking for. But that's to name a few, yeah.
Yeah, no, I'm just wondering, like, what are some of the misconceptions, Dr. Taylor, that some folks might have around naturopathic medicine?
Yeah, I feel like there's a lot.
What are some of the common ones?
Yeah. The common ones I think is one of the biggest ones I think is our scope and what we actually can do, and where we fit in. I find that a lot of people feel like they need to choose between complementary alternative and conventional, and that there's no way that they can work together really well. I feel like that is a bigger systemic problem in terms of just like integrating care better, because I find that healthcare in general is very separate. So that's one area. It's a big misconception. I think the other one is that we don't always follow evidence-based, that it's very woo-woo. Sometimes I feel like we get that a lot, and that we're not maybe real doctors. And so the amount of schooling it takes to become a naturopathic doctor, the examinations, the continuing education is quite intensive. And so that can be a big eye-opener for a lot of individuals, just knowing how much time we spend in school and learning and continuing education, and how much a lot of our things are actually quite evidence-based. And so I think those are the common ones in terms of like where individuals feel like they may not know a lot about where we can fit in.
Yeah, no, definitely. I think that holistic approach is so important. You're looking at the whole person and you're addressing so many lifestyle factors. And like we're talking about hormones and going a little bit more in depth as opposed to just treating the symptoms, right? So that makes
Mm-hmm.
sense. Like, and I love the, the botanicals, and the nature has given us so much. So why not tap into some of those things as well? And then you can use the intravenous and acupuncture and mindfulness meditation. I think those are really great additions to just the medicine part of it. So how
Mm-hmm.
long do typically folks need to see a naturopathic doctor? Like once they've done the initial assessment, what does the treatment plan look like?
Yeah, so again, very much depends on what we use as a treatment, but I will say that I'm sure it's very similar to how long, someone would have to go to see like a therapist, for example. There's a lot to work through. And so when I see a patient for the first time, I often say that, a lot of these things aren't going to happen overnight. We're going to make small, sustainable changes over time. It can look a lot different for individuals, but I like to see at least, maybe one patient for 1 month for a few months just to build a really strong relationship together, pivot on certain treatment plans. But for a lot of the nutrient side and botanical side, I will say that it's very similar to medication, and that a lot of it, in order to see its full effect, if it's going to be effective, we have to wait, the 4 to 8 week period of time. Some people do better sooner. Some people we have to pivot and make changes to. Just it depends on what we're doing. But if it's like a nutrient deficiency or something where we can address, the foundation of health more easily, then maybe we see a boost in certain energy, and then that propels them to do other things that may help in the long term.
Yeah, I like that boost of energy. And then when we don't have good night's sleep, that affects the energy as well. So does naturopathic medicine affects that, like the basics, right? Like the nutrition part, absolutely. But what about like sleep?
Yeah, I didn't mention that. But yeah, I would say like the foundation pieces are, yeah, nutrition, movement, sleep, support. Like having that community sense is such a big piece, I find, for a lot of individuals. But sleep is such an area, I think it's very underrated, I find. And a lot of people struggle with sleep, I find, with mental health and insomnia, or mental health and sleep in general. It's somewhat of a bi-directional pattern there, that it goes both ways. And so in any way we can improve sleep, we may also improve mental health, and vice versa. And so a lot of that is, base sleep hygiene is definitely missing for a lot of individuals. So just, making sure your room is cold and dark and doesn't have any distractions, avoiding blue light and bright light before bed that actually blocks the production of melatonin. Um, and then either doing a relaxation or something to unwind from the day can be really beneficial. Only using the bed for sleep or sex is really the biggest thing in terms of like stimulus control. So those are all kind of like behavioral lifestyle things we work with sleep, but a lot of things can affect sleep as well, physiologically. Same with when we talk about perimenopause and menopause, that's a big aspect of which that can affect sleep, like hot flashes and night sweats. And so addressing that can be really important. Same with thyroid and iron. So it depends on, we look at all of those underlying conditions or aspects that can influence sleep that may also influence mental health. And it's that bi-directional pattern. But sleep is huge.
Yeah, no, definitely. I was very curious. Like sometimes people try to take these natural medications themselves, right? Like with Amazon Boost, like people can
Yes.
order things online. Can we sometimes take too much of a certain botanical or some of these interventions? Can it be too much if we are not seeking a profession and doing it on our own?
Yeah, I think there's a really awesome thing with the internet and how much information is out there. It's definitely have its huge positive and benefits to that, but there's a huge I guess negative aspect to how much information and medical advice is being given on TikTok, Instagram, YouTube, and I find that can be quite difficult to navigate within the communities because we listen to one influencer, for example, who's tried this one thing and may not necessarily have the educational background to provide that information. Same with that, everybody's different. And so people need different dosages of different things.
Yes.
But I would never recommend anyone listening to anything on the internet without going to their healthcare provider for so many reasons. One, yeah, you can definitely overdo it on certain things. You may be spending money on things that don't necessarily have any effectiveness. Just because your friend said it worked doesn't mean it will work for you. There's a lot of different interactions that can happen with certain supplements and medication. And then the last thing too is that I often find people there. This isn't maybe another thing that people think is that just because it's natural doesn't mean it's safe. Just because it's natural doesn't mean that there's no side effects. So those are all things that I talk about with my patients. And then another big thing is like where you're getting your supplements and where you're getting your information from is huge. So certain products might not be as good of a quality, haven't gone through as rigorous testing as some of the professional lines that we use. So maybe it's not that that thing isn't working for you. It's just maybe you're not on the right dose. You're not taking it with the right things. So there's so many different elements to that. And I always advise people to check in with their healthcare provider or someone that's well versed within that realm and has like a clinical focus in that area.
No, that sounds fantastic. So if folks want to reach out to you, what would be the best way, through your website, or should they email you? I'm going to leave all that information in the description below so folks can reach out. And once we put this up online, I'll share it with you as well for your website.
Yeah, I'm pretty active on Instagram with a lot of different things. So you could follow me on Instagram at Dr. Taylor Thurston. And then I also do have my own website, so you can sign up for my newsletter and send out monthly newsletters through there. But if you're ever interested, I do free meet and greets. So if you're curious how naturopathic medicine fits into your care, have any questions specific to you, I'm happy to discuss that as well. But those would be the best ways. Yeah.
Love that. We love that. Thank you so much. Yeah, like doctors are so pressed for time, but you saying that you do free meets and greets is great.
Yeah.
Well, we are almost coming to the end. So thank you so much for sharing your valuable, precious time. We are so appreciative of all your knowledge and everything that you shared. Thank you so much.
Thank you so much for having me. That was great.
Okay.